Cancer. It's a word that strikes fear into the hearts of many. But what exactly is it? Simply put, cancer is a disease that arises from our own cells. Our bodies are made up of trillions of cells, each with a specific job. Usually, cells grow and divide in an orderly way, replacing old or damaged cells. However, sometimes this process goes awry. In cancer, cells start to grow uncontrollably, ignoring the normal signals to stop. These rogue cells can invade nearby tissues and organs, disrupting their normal function. Imagine a garden where weeds start growing out of control, choking out the flowers and vegetables. That's similar to what happens in cancer. This uncontrolled growth can lead to the formation of a mass of tissue called a tumor. Not all tumors are cancerous, though. Some tumors are benign, meaning they are not cancerous and do not spread to other parts of the body. However, malignant tumors are cancerous and can spread, a process called metastasis. Understanding the basic definition of cancer is the first step in demystifying this complex disease. It's about cells gone rogue, multiplying without control, and potentially spreading to wreak havoc elsewhere in the body. Imagine a well-choreographed dance. That's how normal cell growth works. Cells divide and multiply in a controlled and orderly manner, following strict genetic instructions. They know when to grow, when to stop, and when to die off, ensuring the body functions smoothly. Cancer cells, however, dance to a different tune, a chaotic and unpredictable rhythm. They disregard the genetic rules, multiplying uncontrollably and refusing to die off. This leads to an overabundance of abnormal cells, disrupting the body's delicate balance. Think of it like a car with a broken gas pedal. Normal cells are like cars driving at a safe speed, following traffic rules. Cancer cells are like cars with their gas pedals stuck, speeding out of control and causing chaos. This fundamental difference in growth patterns is what sets cancer cells apart. They are rebels without a cause, wreaking havoc on the body's well-oiled machine. Cancer is not a single disease, but rather a collection of over 100 different diseases, each with its own unique characteristics. These diseases are broadly classified based on the type of cell they originate from. Carcinomas. These are the most common type of cancer, arising from epithelial cells that line the surfaces of organs and cavities. Examples include lung, breast, and colorectal cancers. Sarcomas. These cancers originate in connective tissues like bones, muscles, and cartilage. Osteosarcoma, which is bone cancer, and chondrosarcoma, which is cartilage cancer, are examples. Leukemias. These cancers affect the blood-forming cells in the bone marrow. They are characterized by an overproduction of abnormal white blood cells. Lymphomas. These cancers affect the lymphatic system, a critical part of the immune system. Hodgkin lymphoma and non-Hodgkin lymphoma are the main types. Understanding the different types of cancer is crucial for accurate diagnosis and treatment. It's like knowing the difference between a cold and the flu. Both are respiratory illnesses, but they require different approaches to management. Cancer development is a multi-step process, often likened to a series of genetic hits that transform normal cells into cancerous ones. These hits are mutations in the DNA, the blueprint that controls cell growth and behavior. Initiation. The first hit. A normal cell acquires a mutation in its DNA, making it susceptible to becoming cancerous. This could be due to various factors like smoking, radiation, or inherited genetic defects. Promotion. The mutated cell is repeatedly exposed to cancer-promoting agents like tobacco smoke or alcohol, which encourage its proliferation. This leads to a population of precancerous cells. Progression. Further genetic mutations accumulate in the precancerous cells, making them increasingly abnormal and aggressive. They lose their normal controls on growth and begin to invade surrounding tissues. Metastasis. The most advanced stage. Cancer cells break away from the primary tumor and travel through the bloodstream or lymphatic system to distant sites, forming new tumors. This stepwise progression highlights the complexity of cancer development. It's not a single event, but rather a series of missteps at the cellular level, culminating in a potentially life-threatening disease. Section 5. Risk factors, the uncontrollable and the controllable. Cancer risk factors can be modifiable or non-modifiable. Non-modifiable factors include age and genetics. The risk of most cancers increases with age. Inherited gene mutations also play a significant role. Modifiable factors include tobacco use. Diet and physical activity are crucial. Sun exposure is another factor. Understanding these factors is key to prevention. Recognizing the signs and symptoms of cancer. Cancer symptoms often mimic other conditions. Early detection is crucial. Unexplained weight loss, persistent fatigue, persistent pain, skin changes, changes in bowel or bladder habits, persistent cough or hoarseness, lumps or swelling. These symptoms warrant a visit to the doctor. Section 7. Diagnosis and detection, shining a light on cancer. Diagnosing cancer involves a combination of procedures and tests aimed at confirming the presence of the disease, determining its type and stage, and identifying the best course of treatment. Diagnostic tests may include physical examination, a thorough physical exam to look for any abnormalities, imaging tests, X-rays, CT scans, MRI scans, and ultrasounds can help visualize internal organs and detect tumors. Biopsy. A small sample of tissue is removed and examined under a microscope to confirm the presence of cancer cells. Blood tests. Certain blood tests can detect tumor markers, substances released by cancer cells into the blood. Endoscopy. A thin, flexible tube with a camera is inserted into the body to examine the digestive tract or other internal organs. Once a diagnosis is made, the stage of cancer is determined. Staging helps doctors understand the extent of the disease and plan the most effective treatment strategy. Section 8. The Arsenal Against Cancer Treatment Options and Approaches. Cancer treatment is not a one-size-fits-all approach. The choice of treatment depends on various factors, including the type and stage of cancer, the patient's overall health, and personal preferences. Common cancer treatments include surgery, surgically removing the tumor and surrounding tissues. Chemotherapy, using drugs to kill cancer cells or stop them from dividing. Radiation therapy, using high-energy rays to damage and destroy cancer cells. Immunotherapy, boosting the body's own immune system to fight cancer cells. Targeted therapy, using drugs that specifically target certain vulnerabilities within cancer cells. Hormone therapy, blocking or interfering with hormones that fuel the growth of certain cancers. Treatment plans are often tailored to the individual patient, and many patients receive a combination of therapies to achieve the best possible outcomes. Section 9. The importance of early detection. Catching cancer. Off guard. In the battle against cancer, early detection is paramount. The earlier cancer is detected, the greater the chances of successful treatment and long-term survival. When cancer is caught in its early stages, before it has a chance to spread, treatment is often more effective and less invasive. Regular screenings and checkups play a crucial role in early detection. Screenings are tests that look for cancer before symptoms appear, allowing for early diagnosis and intervention. For example, mammograms are used to screen for breast cancer, colonoscopies for colorectal cancer, and Pap tests for cervical cancer. Being proactive about your health and discussing cancer screening recommendations with your doctor can significantly increase the odds of detecting cancer early when it's most treatable. Section 10. Knowledge is power. Staying informed in the fight against cancer. Cancer is a complex and multifaceted disease, but understanding the basics can empower individuals to make informed decisions about their health. From prevention strategies to early detection methods and treatment options, knowledge is key in the fight against cancer. Staying informed about the latest advancements in cancer research, participating in cancer awareness initiatives, and supporting organizations dedicated to finding a cure are all important steps in the collective effort to conquer this disease. Remember, While a cancer diagnosis can be overwhelming, it's not a death sentence. With advancements in medical technology and personalized treatment approaches, there is always hope for a brighter future.